We're here at the OneMedForum, and right now I'm joined with Frank Bellizzi with HydraDx. And Frank, I know you just finished presenting here at the forum. Tell us a little bit about the topic of your discussion and a little bit about HydraDx.
Sure. Well, HydraDx is a medical diagnostic company, and we're focused on point-of-care solutions to measure hydration using biomarkers found in saliva. So when we presented that really received a lot of enthusiastic feedback was we're using a new way to measure state of dehydration using saliva, which allows us to create tests that are inexpensive, accurate, easy to use, easy to read, non-invasive, pain-free, and real-time. So really embodying the holy grail, if you will, of what you'd want to see in a point-of-care diagnostic. And I think the other thing that was really left an impression with people in my presentation was that we've been only around for a little over a year, and with a little bit more than $1 million in our Series A round, we've been able to develop a clinical prototype. We've completed a major study in humans that showed really strong efficacy. In fact, our diagnostic test tracked equivalently to blood tests in terms of being able to tell whether a person was hydrated or dehydrated. So we're really pleased with that. We're obviously taking a lot of steps right now to move forward, both on the developmental focus with the product and as well as to build out a detailed commercialization plan. So we're actually just embarking now on a Series B round of financing, and we're really pleased with the enthusiasm investors have shown so far. So I would add to that, I guess, with dehydration, a lot of people view dehydration as what's the big deal? And actually dehydration is a hugely impactful challenge in the healthcare arena, both for payers, providers, and patients. The reason why is that there is no great way to measure dehydration, and it doesn't rise right now to the standard of people really focusing on it in a preventive and early management profile. So our product can really change the way care is delivered and meaningfully impact, save billions of dollars in our healthcare system, improve payer and provider satisfaction, then obviously have better outcomes for patients, which is something that we're very pleased to be able to help lend our support towards.
Great. So you guys are a pretty young company,
yes.
And as you move forward trying to gain more financing, can you talk a little bit about the market opportunities for the technology?
Yeah, absolutely. One of the things we did first off was, dehydration, it affects every disease state and every organ function, so there were actually a lot of opportunities to look at. Pregnancy, sports performance, military, infants, elderly, so there, congestive heart failure and other chronic diseases. So we actually looked at about a half dozen of the most interesting and opportunistic situations, and we did a significant amount of analysis, case studies, focus groups. We brought in some external experts to do landscape analyses and commercialization planning. And so we really triangulated and spent a lot of time really trying to validate the need state. I think a lot of companies don't take the time up front to do that, and it becomes then a big problem downstream when you think you have something and then you really don't. So after months of evaluation, we chose our first market foray, which is going to be into the long-term care market, specifically in skilled nursing facilities. The elderly creates a huge opportunity for us with our product because dehydration affects everything from their having falls when they're older to unnecessary medications that are being dispensed due to mental acuity, urinary tract infections, bed ulcers. And so estimates show that there's over $10 billion of indirect costs from dehydration-related ailments in the elderly and over $2 billion of direct costs. So a really big market opportunity, but also one that we like because we can move from a skilled nursing approach downstream into assisted living and home care, and then also migrate upstream into an acute setting. So it gives us a really nice platform. In addition, we've got a great strategic partner. We've been able to get a customer, early adopter, as well as a distributor. So we feel like we have a really good iterative feedback loop as we develop our product and our commercialization strategy. And ultimately, once we get clearance from FDA, that we can hit the ground running and really get traction quickly in the market.
Okay, as you look to move forward, how do you think the forum here can help you, and what is your outlook for 2010?
Well, I think the forums, it's always great to be in front of smart people who are in the industry, whether they're analysts, whether they're supporters. I mean, I met after my presentation not only with interested investors, but with a design firm that's interested in helping us with the design of our product. So there's really a multiple dimensions of value of being in an environment like this that's always very helpful. I mean, going forward, I think we have a lot of the same challenges that early stage companies face, which is we need to remain focused. We need to move forward, logically, both with our scientific and clinical development, as well as our commercialization strategies. But I'm confident that the path we're on has been so far very good. We've achieved all of our milestones that we set out in the first year. and we're actually ahead of schedule in all of the different ways that we track our progress. So I'm optimistic about where we're going, and the other thing I'd add is that we've been able to develop a really strong team. I think it's definitely reflective of the quality of the company and the opportunity that we're going after. I think people feel passionate about it and feel like we can really make a difference. And I think it's also reflective of actually a pretty good job environment. You know, as the CEO of a startup, this is probably one of the best times in the last 15 or 20 years to build a business. So I think,
even despite the economic climate?
Despite the economic climate, I would argue that good companies get funded in all climates. I think we rise because of the characteristics of our opportunity, very much the characteristics of our business and where we're trying to go meet very well with the criteria of this more critical investor environment. And then I think also with healthcare reform and where things are going from a policy perspective, having a preventive product that empowers patients, that can not only prevent disease and the costly acuity and downstream cost and outcomes, but also be able to impact providers with better solutions, is exactly what any specific form of reform is going to require. So evidence-based, high quality, precision, low
healthcare
cost.
savings.
Exactly. So we're really moving in a direction that we have tailwinds rather than headwinds. Now, in all cases, companies like ours are going to have speed bumps and move sideways occasionally. We've been fortunate not to have experienced that yet. I anticipate at some point we'll have the challenges that all companies have, and I think we've been able, with the team we've been able to assemble, we can not only hit the ground running, but I think we'll be able to manage through the challenges that we may face going forward.
Great. Well, thank you, Frank, for taking a little bit of time to talk to me, and good luck in the future.
Thank you very much.